A healthier, happier life begins here. Welcome to Mercy Moments, a podcast by Mercy Health in association with True Chat.
In a recent study, it was determined that even chronically ill people are just a little more likely of having some sort of advanced care plan. Things like a living will or durable power of attorney are often not considered. Thank you for tuning in today. I'm your host for Mercy Moments, T. Alan Ceyler, coming to you from Champaign County here at True Chat Studios in Urbana, Ohio. For many years, she has been a registered nurse and case manager, and is now the director of case management for Mercy Health Springfield and Urbana Hospital. Please welcome to the program, Christa Sisler. Christa, welcome.
Thanks, Terry. As Terry said, I am the Director of Case Management for Springfield and Urbana and have recently stretched out into the Enon area as well with the opening of our new Enon Emergency Department. I have been at the hospital as an employee for as long as I can remember. I started as a volunteer a long, long time ago when I was a teenager.
Really?
And I've never left. So everybody knows me there. I have lots of different individuals that I can talk to at the hospital that are very open to listening about this type of topic. So I think that it's a great time to talk about it with everybody else.
So Christa, what exactly is advanced care planning?
So advanced care planning is when an individual decides to think about their wishes way in advance of when they're actually going to need it. You can never be too young to get an advanced care plan done. As long as you're 18 or older and can make decisions for yourself, you are able to make a healthcare advanced directive. And that's always a good plan because you never know when something's going to happen and that's needed. So with the advanced care planning, one of the best ways you can do that is to do advanced directives. And advanced directives and advanced care planning, they go together, but they are different. So advanced directives, they let you tell your healthcare decision makers how you want your healthcare to be managed if you're unable to speak for yourself.
I see.
So if you have a person that comes into the hospital and they're not able to make decisions, we're going to default to a certain person based on Ohio's hierarchy. So if you want to be able to pick who that person is, it's really important to make your wishes known to everybody. Let your loved ones know, let your faith leader know, let your care team know as soon as you enter the hospital. And the best option is going to be to have that advanced care planning document with you.
So what are the different types of planning?
So there's quite a few, actually. The first one that we'll talk about is the durable power of attorney for healthcare. Now, I say for healthcare, I like to make that differentiation because there's two different durable power of attorneys. There's the financial and there's a healthcare. So the one for the hospital, the one for healthcare is going to be the durable power of attorney for healthcare. And it lets an individual pick who they want as their designated decision maker if they can't make decisions.
I see.
The living will kind of lumps in with that durable power of attorney for healthcare. You can actually get the entire document together. So the living will lets you pick specific things that you want to address, organ donation, pain management. If you want to have like a feeding tube placed and things like that, you can address that specifically in the living will. And your living will takes precedent over your power of attorney. So if you say no feeding tube, but your power of attorney says yes feeding tube, the answer is no feeding tube. The next one is going to be your physician orders for code statuses. So if you've ever been in the hospital, then you're going to know the doctor asks you if you want to be a full code or a do not resuscitate, and they should be explaining that to you so that you know the difference. So the ones that you're going to have the options for, there's a full code, there's a do not resuscitate comfort care arrest, and a do not resuscitate comfort care. These orders are only active while you're in the hospital. So if you want to make that order a permanent thing, then you need to have the portable do not resuscitate form that your doctor fills out. And then you can hand that to the squad and let them know, I have a DNR, and they'll follow those wishes outside the hospital too. And then the last one, which isn't really used that often, but it's a good advanced care plan to have is called the MOLST. It's Medical Orders for Life-Sustaining Treatment. And it's a set of orders that's similar to your DNR orders that your doctor can fill out if you and your doctor discuss it and you think there's about a year or less before you're going to need to have decisions made for you. You can fill out all of that in advance, and it's a very neutral form. It takes into consideration your religious preferences. It lets your healthcare team know if you want a natural death, what you want to occur.
So can you describe some of the different types of intervention?
Absolutely. So as I said just a few minutes ago, there is a full code. There's a do not resuscitate comfort care arrest and a do not resuscitate comfort care. So in Ohio, it gets a little bit confusing for people because that do not resuscitate comfort care arrest doesn't actually exist in most states. So if you have a do not resuscitate comfort care arrest in Ohio, it may not be useful in another state, but it is here in Ohio. So full code. We're going to do everything we possibly can to help you. So we're going to intubate you. We're going to do surgery. We're going to give you drips that are going to be medicated that are going to help you live. We'll do everything, CPR, all of it, until we're told otherwise by your family or if you have a document. The do not resuscitate comfort care arrest, the easiest way to remember this, because this one confuses people, it's essentially the exact same thing as a full code up until you experience no more breathing, no more heartbeat, and then we're going to turn you into a do not resuscitate, and it's going to be just comfort measures. Everything up until your heart stops beating or you stop breathing. That means we're going to be able to put you on a ventilator if you haven't stopped breathing already. We're going to be able to do surgery. We're going to give you drips that are medicated. We'll do everything we can until your heart stops beating. And then the last one, of course, do not resuscitate comfort care. This one gets people confused a lot. They actually feel like this means that we're not going to do anything for them ever, but it doesn't mean that at all. You're going to get the regular care you would normally get. This just means that we're not going to take all those extra measures to try to prolong your living. We're not going to do the medicated drips. We're not going to put you on a cardiac monitor to watch and see what your heart rate looks like. We don't need all that stuff to make you comfortable. We don't need to know those things, and your family doesn't need to watch those things for us to be able to make you comfortable. So you're going to be able to have oxygen. We'll put you on IV medications they'll help make you comfortable, but it's not meant to make you better. So that's what that DNR is.
We'd like to take this time to remind our listeners that all of True Chat's podcasts help pursue a common goal: to educate people by providing honest, open, and respectful conversations. To learn more about Mercy Moments and to find out where you can listen to us or engage with our program, please visit us at mercymoments.org. So just to recap, our conversation today has been about advanced care planning, and my guest today has been Christa Sisler. Christa, welcome back.
Thanks, Terry.
So who are some of the people that can make decisions about advanced care planning?
That's a great question. There are a lot of details that go into that, actually. So advanced care planning decisions that involve withholding or withdrawing any kind of life-sustaining measures, they can only be made by the patient themselves if they're able to. So if you are capable of making a decision and you're over 18, you can make that decision yourself. With a healthcare power of attorney, it doesn't kick in until you can no longer make your decisions.
I see.
So a lot of people, they have those healthcare power of attorneys already, but it's really important for their healthcare decision maker to understand that healthcare power of attorney document does not kick in until the patient can no longer make their own decisions. So we'll talk to the healthcare power of attorneys if the patient wishes that, but up until they can't, it's going to be that patient making that decision. So once they can't make decisions anymore, which we'll talk about that a little bit later about what would cause them not to be able to make decisions, their durable power of attorney for healthcare would take over if there is one. So mostly what we find is that there's not one. And that's where our issue comes in, is a lot of people don't know they even exist.
I see.
So we would love for everybody to have one, but because everybody doesn't have a healthcare power of attorney, there is an Ohio hierarchy for next of kin. So on the Ohio hierarchy of next of kin, it's very specific, and the hospital will follow step by step by step who that person is allowed to have to make decisions for them.
Interesting.
So if there's nobody that can make decisions for this patient, there's no family, even we'll stretch out all the way to third cousins if we have to. I mean, we'll go as far down the line as we have to. But if we cannot find anybody that can make a good decision for this patient and they're not able to make decisions, then we will have the courts get involved and we'll get a court-appointed guardian assigned to them. That way somebody can make decisions for that patient at all times.
So what exactly does incapacity mean?
With incapacity, a patient that's been deemed incapable can't make decisions. But to be deemed incapable, a physician has to go in, do an assessment, and actually say, this patient is not able to make their own decisions. When you're talking about the healthcare power of attorney, it just takes one physician to say that. When you're talking about the living will, it takes two. So that living will won't kick in until two physicians say, this patient can't make their own decisions and there's nobody to make decisions right now. Then they'll be deemed incapable of making decisions.
So you touched on earlier that different states have different rules. So how does Ohio actually define capacity?
So Ohio defines capacity as an individual being able to make an informed decision and know what that decision means. So they have to understand the nature of it, the extent, any probable consequences of that healthcare decision. They have to be able to make a rational evaluation of risks and benefits. So if I'm talking to a patient, I want to be able to say, your doctor wants you to have this surgery. Do you know what that surgery means? And do you know what might happen after that surgery? They have to be able to tell me they understand that and give me in their own words what that surgery is and what it means for them. And then they have to be able to communicate in any way. It doesn't have to be verbal. There's plenty of patients out there that are not able to speak to us, but they're able to tell us what they need. That happens all the time. So as long as they can let us know somehow that they understand in a form that we're going to be able to use at any point in the future, then we can use that as capacity for them.
So what are some other important tips that you think people need to know about planning?
So the big thing, and this comes up a lot, family members can't make decisions in the advance directive for the individual. That document is specific to that patient. They make their own choices. So the whole idea of an advance directive is that you as the patient are making that choice in advance so that if something happens, they already know what your wishes are and you don't have to worry about your family having to make that hard decision because those decisions are very hard.
Right.
So family members can't make those decisions in the advance directive initially. Once the advance directive's in place, then we will fall to that next of kin or the healthcare power of attorney to make decisions. Advance directives, they can only be completed when the individual has capacity for it. So we talked about that. And anyone over the age of 18 who can make their own decisions can complete that advance directive form. You don't have to have a lawyer. A lot of people ask that question. They want to know if they have to go to a lawyer and get it formally done. You don't have to do that. With the healthcare power of attorney for healthcare, you just need two witnesses that are not related to you. Can't be your doctor. If you live in a nursing home, it can't be the administrator of that nursing home. It can't be the people who you're designating as your first and second healthcare decision makers. You can also do a notary. So if you have a notary, you can just take this form to the notary. They're going to have you sign in front of them. So don't sign those papers until you're physically in front of that notary because they have to witness you signing that. But that makes it so much easier for everybody. You don't have to have a notary. Or you don't, sorry, Blue. You don't have to have a lawyer for that. You can have two witnesses that aren't related to you, not your doctor, not your administrator at a nursing home, or a notary.
So final question. Where can people go to find out more about planning?
There are a lot of resources out there. You just have to know where to find them. So, of course, the internet is always going to be a good option for you. If you just go to the internet and type in Ohio Advanced Directives, make sure it's for your state because the advanced directives are different. So just type in Ohio Advanced Directives. there is the Ohio Department of Health will give you a link. The very first link you see, it's the ohiohospitals.org link. That takes you right to the entire document for both the healthcare power of attorney and the living will. And you can just print that out and take it to a notary or have a couple witnesses there with you. You can also just give your local hospital a call. They usually have those documents on hand, and they would be more than happy to help you fill that out because it's going to help them in the future. So they're going to want you to have those documents. So it's easy to get those documents. Local hospital, once you get admitted to the hospital, you're going to be offered that anyways. So if you don't have one already, be prepared for that to be a question when you actually get into the hospital. They'll ask you about your advance directives.
Again, I'd like to thank my guest today, Christa Sisler, for being here. You can listen to Mercy Moments on TrueChat via Spotify, Apple Podcasts, Overcast, and anywhere else podcasts are found. For Mercy Moments, Mercy Health Urbana Hospital, and TrueChat, I'm your host, T. Allen Ceyler.
And I'm Christa Sisler.
Thank you for listening today. Stay healthy, Ohio.